like what happened? Like, why did my heart fail? And we used to say idiopathic. There's something called idiopathic cardiomyopathy. You know what idiopathic means?
Please tell me.
Idiopathic means doctor's an idiot and patient's pathetic. So doctor has no clue.
Oh, this is great. Oh man. Well, you got me there.
That's okay.
Oh,
so, so, so,
I
so,
did not
so that
expect that.
no, but that's true. That's what idiopathic means. Oh, well, in my vocabulary at least, because we have no idea. We want to sound very educated to the patient, and the patient feels, oh, I'm getting a big diagnosis, but it means a useless diagnosis. We have no answer. So, looking for an answer, looking for why we have the problem and why they're suffering, what more we can do better. So that motivated me more towards precision medicine, genomics, artificial intelligence, and understanding how we can bring the best from the DNA, best from the omics sciences, so I can help my patient population. From there, I can help people globally.
Wow. Okay, that helps. There's a lot of people lost a lot of trust in doctors over the last few years, and it's good to see that a lot of good doctors out there earning that trust back. I'm a fan of doctors. I when I go get my blood work, get my calcium scoring, I'm one of those guys. Bodybuilders tend to be really health conscious because we took some risks in the past. A lot of us did. And honestly, then you get older and you're like, I don't really want to meet God yet. As you say, I'd love to meet God one day, but just not today. Not today. So, speaking of the heart, what are some of the most common heart conditions you see in your practice?
I do see people, young people with blockages in the heart arteries. I do see a woman, either rupture of their coronary artery suddenly, they're exercising, it happens. I do see patients with heart failure and as young as 25-year-old. I have no blockages in the heart arteries at all. Then I see patients with sudden death on the field. And they had some kind of collapsing on the field. Then they got revived and survived. We re-stratify them. So I see every kind of patient population, patient who had a bypasses, after bypasses, are they on the right medications? Many times people come to me, they say, Dr. Kapoor, I'm having this muscle aches and pains. Once I left hospital, they gave me this statin, that medication. They're good medications, but in some people, they cannot tolerate it and
Mhm.
they come to see me for second opinion. So every kind of patient, and sometimes a patient with a hypertrophic cardiomyopathy, a disease you may have heard when people on the basketball field or a soccer field, they
Yeah.
collapse suddenly. And what they found is the heart is very thick. The muscle is thick. The heart cavity should be big, becomes a very thin cavity. And the muscle is so big, like a muscle building. And it's a genetic condition. So a lot of time patients come in, look, my brother got it. Do I have the disease? My daughter got it, my other kids, I'm worried about it, and they bring their family. We do genetic testing for them, we do ultrasounds for them, and then help them to
Yeah.
stratify to tell them who may have a gene, who does not have a gene. So then we help them channel this system versus be worried about all the time. So you can imagine anywhere from a 15-year-old kid to a 90-year-old, 98-year-old. They all come to our practices, our clinics, and they access our services.
Okay. Have you seen an uptick in heart issues lately? There's a lot of things going around. You've seen the whole died suddenly thing. I don't want to go there. This isn't, we're not that kind of podcast. We're a fitness podcast. Have you seen an uptick in young, presumably healthy people having heart issues? And what do you think is causing that? It just seems, again, just a layperson looking in, and you see like, LeBron James kid, and you see the soccer players all of a sudden, whether it was just popularized because the political environment at the time or whatever it is, but you see these cases of presumed young, healthy individuals having heart issues. Are you seeing an uptick in that? And if yes, what do you think the cause would be?
Well, I do see patients with a heart failure, young patients. I do see young patients with arrhythmias and the risk for sudden death risk is out there. So especially in the sports side, there's something cool technology we have built called the Biosport, the biosport.com, and we're looking to
Okay.
commercialize it later on. So what it does, it looks at the DNA, the whole genome sequencing, and tells us any risk for sudden death, any arrhythmias. It also tells us any congenital heart disease they may have, it could be inheriting, or they could be passing on to their kids. So we get all this information, then we personalize the treatment plans for them, personalize the exercise programs for them. And I do see young patients sometimes coming with a premature heart disease, the blockage in the heart arteries. Why?
Yeah.
Because they have a genetic mutation. And those genetic mutations put them at high risk for developing coronary calcium score being higher, and these blockages are happening at much younger age. And other thing which I do believe is contributing is microplastic. We don't talk about much.
Really?
Yes,
Okay.
yes,
Okay.
yes.
Let's dive into microplastics and heart. Go. Let's rock. I've never heard
Yes.
anybody else talk about this.
Yeah, so please don't eat plastic. Please don't drink plastic. Please don't do that. So that's a simple message I want to tell to everyone today is. And people say, look, I don't eat plastic. I eat normal food. Well, if you're cooking in a plastic cookware or if you're heating it, if you put the hot meal in a plastic container, plastic is coming in. If you're using a plastic water bottle and the water has been stayed there for a long time, in a heat, the plastic is coming in. If you're drinking from the Coke can, people say aluminum, but there's a plastic layer inside. Plastic is coming in. If you're using a canned tomatoes, and this is a metal outside, but inside is a plastic layer. Plastic is coming in. So
Huh.
plastic is coming in for as simple as your Starbucks coffee cup, or coming in when you're heating it in a plane ride when the meal they give it to you. So what you should do is you should cut down your plastic intake as much as you can. Why? Because we see now microplastics getting deposited in the heart arteries, in the brain, in the neck arteries. We see microplastic deposit in the testicles even. So it's the biggest contaminant right now we have in our body, and we have to put an effort because what it's doing is it is creating this calcification, this reaction in the body. The blockages are happening, and they're triggering the heart attack, triggering strokes, and causing impotence, mental health issues, and so many issues and challenges in the body. So let's all of us work towards cutting down the plastic intake.
That's fascinating. My wife just switched out all of our plastic Tupperware with glass, and we have our reheatable food containers. They're all the steel ones, the ones that keep things nice and warm all day. I'm starting to feel a lot better. But I've never heard someone talk about microplastics and the increase in
Yes.
heart issues. I've never heard that before. And I mean, what? So the mechanisms of action for that to happen. Let's say I'm consuming a high amount of environmental microplastics. Would that clog it? What reaction does that cause within the heart, within the body, within the testicles, within any organ, any feature that would cause those type of deleterious effects?
Just think of this way: plastic is a foreign body. Our body is not designed to handle microplastics. What does body do? The normal response to body is whenever you give anything outside, anything foreign, body either try to reject it or try to accept it by covering it with the cells. So when the plastic goes inside the body in those arteries, what it does, it triggers a reaction, it harms the sensitive layer inside, and then suddenly the deposits start to happen with the blockages, and the way calcium get acquired, the way plastic also get acquired, and the more and bigger blockages start to happen. So when that is happening, this plastic also triggers inflammation at that level. It's a foreign body. Body's trying to reject it or trying to accept it and try to cover it. So that's a normal natural reaction. So what it does, it now start to kill the cells around it. There's a plastic there. And the cells in the testicles or cells in the brain, in the carotid arteries, in the heart arteries. And eventually the cells become atrophic there. And this reaction continues to happen. And we never knew that before. Like why some people develop blockages more than other people from the same family. So diet plays a huge role. This microplastic, we believe, plays a huge role. And it's been discovered last few years. It has been found in various autopsies now. Even
Yes.
lately, it's been linked to dementia in brain.
Wow. I knew about those studies. I never heard it explained like that. This is why I love having this podcast, because I learn. I can't listen to every podcast, but the amount of information I learned, this podcast is a selfish thing for me. Holy crap. That is insane.